Here is a couple who had come in their mid-30s, having undergone 3 cycles of IVF. In each cycle, there were embryos that were forming till day 3, but then they were getting arrested after that. The couple had undergone 2 embryo transfers also with day 3 embryos, but there was no implantation, there was no pregnancy, and she had no answers. So doctor, when the couple had come to you, to Milann, what did you initially suspect?
So we have reviewed extensively their embryology record. And what we found pretty interesting is that the embryos were getting arrested at day 3. Now, that is a phase where rapid mitotic cell division happens. So that raised concern. So we further scrutinized, we looked into every minute detail, and what we could possibly find is that there is a possible error, or I would say there's an asynchrony in the cell division. Now, that is a clue which point towards a possible DNA damage.
Okay, right. So you're saying that the eggs looked fine.
Yeah.
So what exactly was the stage at which you suspected that there could be a problem with the sperm?
Considering the fact that the couple had underwent 3 failed IVF cycles and the semen analysis looked average, we asked for an DFI test. And when we did that, it came out more than 30% fragmentation.
So doctor, what is the normal range for a DFI?
30%. So if it is less than 30%, it's fair enough. We can consider more than 30%. We have to employ techniques to, I would say, filter the good ones from bad ones. So the pool with which we have to select will be a little bit difficult when the DFI values go a bit on the higher side. That is, the 30% is a cutoff that we give.
Okay, fine. That's a great point that you brought in, doctor. So having said that, we all know about the importance of what the DNA is, okay? So having said that, the person's DFI was over 30%. So what exactly could be the cause for a high DNA fragmentation?
It can stem from various lifestyle issues like obesity, smoking, alcohol consumption, stress. These all can lead into high DFI.
So for this patient, could you find something significant from the lifestyle?
Yeah, he was a bit obese.
Okay.
And apart from that, it was chronic alcohol consumption was there. So this all would have pertained to the high DFI in this particular case.
Okay. So having discovered that the patient's DFI was high, so what is the treatment modality that you have offered for this case, doctor?
Yeah, at Milann, actually, with regard to DFI, we have a set of protocol set in place. So when we treat a patient with the technique which we employ for a 20% DFI, will be different from that of a 40%. We come up with microfluidic sperm sorters. I mean, these are advanced DFI cases. There will be zona binding is another strategy that we do for high DFI cases. There is in fact a very important technique which we do in Milann, which is called as positive rheotaxis ICSI. It's a specialized ICSI exclusively done for high DFI cases. So with the advent of these, usually we get good outcome whenever we deal with high DFI cases.
Okay. So in brief, doctor, you're saying first and foremost addressing lifestyle factors is very important.
Absolutely.
So then from a laboratory perspective, the embryologist uses certain advanced techniques to try and filter out the sperm which is relatively healthy, probably having a lesser DFI. Doctor, are there any surgical methods that can probably try and reduce the DFI?
Yeah, in fact, in this particular case, when we reassessed the sample, there was no significant change with regard to the values.
So it still stayed 30% even after addressing the lifestyle.
With antioxidants and all, still the values wasn't that good, I would say. So what we have done is that we have done something called as TISA. Now, where we directly take the sperms from the testis and we did the ICSI. And we have selected the best embryos for the possible better outcome. And it clicked, actually. It was a healthy blastocyst. And
so definitely there was conversion from a day 3 to day 5 that had happened.
Yes, absolutely.
Okay. And what was the result of the embryo transfer?
It was a successful implantation.
Okay, wonderful. Sometimes what looks unexplained is just undetected. At Milann, we go deeper into advanced DNA fragmentation testing, advanced methods for sperm selection in the embryology laboratory, AI-powered embryo selection, so as to help every embryo grow and enable each couple to achieve their dream of parenthood.